Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about price shopping and the future of consumerism. Well, one study found that consumers with high deductible plans are actually cutting back on their health spending across the board, including necessary care. That study found no evidence of shopping. So while this is just one study, it might indicate that reduced spending for these consumers is coming from reduced utilization, not from making better choices. Clearly, that's not the outcome that was intended. Don't get fooled. It's not an excuse to avoid taking action. The main conclusion should be that we need to make it easier for consumers to get information about what they're buying, and that includes both price and quality information. Some industry folks are ready to say that consumers don't shop for healthcare because healthcare is different. It's actually more of a case of healthcare shopping is different. Healthcare is probably the only consumer service where you can't get prices online, you have to contact 3 or 4 different places to get a price estimate, and you have to work pretty hard just to figure out what those places are. Only the most motivated and sophisticated consumers are likely to take that on. Let's focus on getting to a point where most consumers can access accurate, relevant, and timely information about healthcare price and quality before we write off consumerism. Remember, these are not unreasonable requests. So let's develop apps that work. Let's create websites that allow people to comparison shop as easily as they do for other consumer goods. Let's develop the capability to answer questions about price and quality on the phone, in real time, without all the caveats and disclaimers we need to use now. Then we can make a meaningful assessment of the future of consumerism in healthcare. The place to start is with the fundamentals. Technology only helps if it's built on a solid foundation. So for starters, take a close look at HFMA's Patient Financial Communications Best Practices and see how your organization measures up. We now have 62 hospitals and 68 clinics that have been recognized as adopters of these best practices. They tell us that going through the adopter application process helped them identify gaps and areas for improvement and build a more consumer-centered financial experience. All the information is at hfma.org/dollars. It's a great place to start. Thanks for watching. I'll see you next month.